Wisconsin Department of Workforce Development says the healthcare industry is growing quickly, and so is demand for nurses. Nursing schools are struggling to keep up with that demand, citing a lack of instructors and not enough students to fill future roles. Local 5's Robin Agenye is live in studio now with more. Robin.
Aaron, Wisconsin has an aging population, which means in the next decade, more people will be seeking health services. I talked to one area nursing school that says finding the people to fill much needed roles is easier said than done.
You can feel like how squishy it is down here.
Students at Belling College say they've thought about their careers beyond the classroom. They aren't positive that it will include working with patients 65 years plus.
It is an area or population that is going to need more health care going forward. So being in the position and learning everything that I am, I think I'm not closed off to it. It's something I would consider.
Wisconsin's aging population will shoot up 72% in the next 25 years, which means more nurses will need to be available.
There's always been that misconception that, working with older adults is working with them in a nursing home or a long-term care setting. But nurses in any area that they're working are going to be working with older adults.
According to the Wisconsin Center on Nursing, if the amount of students trickling into Wisconsin nursing schools continues as it is now, there won't be enough nurses to fill positions by 2026. Here's the outlook. Right now, there are 47 schools of nursing in Wisconsin, which graduate about 3,500 students. There will be at least 5,300 open nursing positions in the next 5 years. The average age of a nurse is 47. More than 3,700 retire after 64. And between 2015 and 2040, the number of folks 65 and older will grow by 640,000. Also an issue, there aren't enough nursing instructors in the classrooms, especially for clinicals.
In clinicals, we're supervised in a lot of the skills that we're performing, so giving meds, starting IVs, anything new that we haven't done before. And so when you have a group of 7 or 8 students to one teacher, it's a little more difficult to get that one-on-one attention.
Whether the shortage is in the classroom or the hospital, it may just be a sign of the times.
When we have a strong economy like we have now, you have less people in general maybe seeking out college and less people seeking out programs like nursing. Our profession, there's always that ebb and flow.
The Wisconsin Department of Health Services says 18 counties in Wisconsin are expected to have at least 33% of their total population ages 65 and older by 2040. In the studio, Robin Agenye, Local 5 News.